Hello everyone, welcome back. This is Mike. Today we'll continue our discussion on respiratory disorders, diagnosis, management, and prevention. Today's topic is pulmonary vascular disorders. We will be discussing pulmonary embolism. Pulmonary embolism is a blockage in one of the pulmonary arteries in the lungs. In most cases, pulmonary embolism is caused by blood clots that travel to the lungs from deep veins in the legs or rarely from veins in other parts of the body, called deep vein thrombosis. Because the clots block blood flow to the lungs, pulmonary embolism can be life-threatening. However, prompt treatment greatly reduces the risk of death. Taking measures to prevent blood clots in the legs will help protect against pulmonary embolism. It is found in 50% of autopsies. It most often originates from venous thrombosis of lower extremities or the pelvis. It is rarely due to non-thrombotic material such as fat, amniotic fluid, tumor cells, or bone marrow and foreign body, like bullet fragments. It occurs in clinical settings marked by venous stasis, which includes 1. Primary venous disease, 2. Congestive heart failure, 3. Prolonged bed rest or immobilization, and lastly, prolonged sitting while traveling. It is predisposed by cancer, multiple fractures, and use of oral contraceptives. It results in hemorrhagic or red infarcts in 10% of cases, usually in patients with compromised circulation. It has variable clinical consequences from asymptomatic to sudden death. Symptoms of pulmonary embolism vary greatly, depending on how much lung is involved, the size of the clots, and whether there is underlying lung or heart disease. Common signs and symptoms include the following. 1. Dyspnea typically appears suddenly and always gets worse with exertion. 2. Chest pain may mimic angina. This pain is often sharp and felt on deep inspiration, often stopping deep breathing. Can also happen when coughing, bending, or stooping. 3. Is cough. The cough may produce bloody or blood-streaked sputum. Other signs and symptoms that can occur with pulmonary embolism include 1. Arrhythmia, 2. Lightheadedness or dizziness, 3. Diaphoresis or excess sweating, 4. Fever, 5. Leg pain or swelling, or both, usually in the cough caused by deep vein thrombosis, and lastly, cold, clammy skin and cyanosis. What are the causes of pulmonary embolism? Pulmonary embolism occurs when a clump of material, most often blood clot, gets wedged into a pulmonary artery. They most often comes from the deep veins of the leg, known as deep vein thrombosis or DVT. Usually multiple clots are involved, leading to multiple pulmonary infarction, compromising respiration and oxygenation. Other substances that can cause pulmonary embolism includes the following. 1. Fat from the marrow of a broken long bone, 2. Part of a tumor, and 3. Air bubbles. What are the risk factors for pulmonary emboli? First, family history of venous blood clots or pulmonary embolism in the past. Second, medical conditions and treatments. They include 1. Heart disease. Cardiovascular disease, specifically heart failure, makes thrombosis and embolism more likely. 2. Cancer. Certain cancers, especially brain, ovary, pancreas, colon, stomach, lung, and kidney cancers, and cancers that have spread, can increase the risk of blood clots, and chemotherapy further increases the risk. Women taking tamoxifen or raloxifene also are at higher risk for blood clots. 3. Surgery. Surgery is one of the leading causes of thromboembolism. For this reason, anticoagulants may be given before and after major surgery, such as joint replacement. 4. Disorders that affect clotting. Some inherited disorders affect blood, making it more prone to clot. Other medical disorders such as kidney disease can also increase clotting risk. Lastly, coronavirus disease 2019 or COVID-19. People who have severe symptoms of COVID-19 have an increased risk of pulmonary embolism. Third is prolonged immobility. They include bed rest, being confined to bed for an extended period after surgery, a heart attack, leg fracture, trauma, or any serious illness increases the risk. When the lower extremities are horizontal for long periods, the flow of venous blood slows and blood can pool in the leg, sometimes resulting in blood clots. 2. Long trips. Sitting in a cramped position during the lengthy plane or car trips slows blood flow in the legs, which contributes to the formation of clots. Fourth, other risk factors. They include 1. Smoking. Tobacco use predisposes some people to blood clot formation, especially when combined with other risk factors. 2. Being overweight. Excess weight increases the risk of blood clots. 3. Supplemental estrogen. The estrogen in birth control pills and in hormone replacement therapy can increase clotting factors in the blood, especially if the patient smokes or are overweight. And lastly, pregnancy. The weight of the baby pressing on the veins in the pelvis can slow blood return from the legs. Clots are more likely to form when blood flow is slow. What are the complications of pulmonary embolism? Pulmonary embolism can be life-threatening. About one-third of people with undiagnosed and untreated pulmonary embolism don't survive. When the condition is diagnosed and treated promptly, however, that number drops dramatically. Pulmonary embolism can also lead to pulmonary hypertension, a condition in which the blood pressure in the lungs and in the right side of the heart is elevated. The obstructed pulmonary arteries increases blood pressure and eventually leads to heart failure. In rare cases, small emboli occur frequently and develop over time, resulting in chronic pulmonary hypertension, also known as chronic thromboembolic pulmonary hypertension. How do we prevent pulmonary embolism? Preventing deep vein thrombosis will help prevent pulmonary embolism. For this reason, most hospitals are aggressive about taking measures to prevent blood clots. They include 1. Anticoagulants, which are given to people at high risk of thrombosis before and after an operation, as well as to people admitted to the hospital with medical conditions such as heart attack, stroke, or complications of cancer. 2. Compression stockings. Compression stockings steadily squeeze the legs, helping the veins and leg muscles move blood more efficiently. They offer a safe, simple, and inexpensive way to keep blood from stagnating during and after general surgery. Third is leg elevation. Elevating the legs when possible and during the night also can be very effective. Raise the bottom of the bed 4 to 6 inches or 10 to 15 centimeters high with blocks or books. Fourth is physical activity. Moving as soon as possible after surgery can help prevent pulmonary emboli and hasten recovery overall. And lastly, pneumatic compression. This treatment uses thigh-high or calf-high cuffs that automatically inflate with air and deflate every few minutes to massage and squeeze the veins in the legs and improve blood flow. Now, how do we prevent pulmonary embolism while traveling? The risk of thrombosis while traveling is low, but increases as long-haul travel increases. First, drink plenty of fluids. Water is the best liquid for preventing dehydration, which can contribute to thrombosis. Avoid alcohol, which contributes to fluid loss. 2. Take a break from sitting. Move around the airplane cabin once an hour or so. If driving, stop every so often and walk around the car a couple of times. Do a few deep knee bends. Third, fidget in the seat. Flex the ankles every 15 to 30 minutes. And lastly, wear support stockings. Recommended to help promote circulation and fluid movement in the legs. Compression stockings are available in a range of stylish colors and textures. How is pulmonary embolism diagnosed? Pulmonary embolism can be difficult to diagnose, especially in people who have underlying heart or lung disease. For that reason, medical history, physical exam, and lab tests are important. The following tests are usually used. 1. Blood test. Blood-dissolving substance like D-dimer. High levels may suggest an increased likelihood of blood clots, although many other factors can also cause high D-dimer levels. 2. Arterial blood gas measures the amount of oxygen and carbon dioxide in the blood, and pulmonary embolus may lower the level of blood oxygen. Third, blood test for inherited clotting disorders. Second is chest X-ray. Although chest X-ray can diagnose pulmonary embolism and may even appear normal when pulmonary embolism exists, they can rule out conditions that mimic the disease. Third is ultrasound. Doppler ultrasonography, also called duplex scan or compression ultrasonography, uses sound waves to scan veins in the thigh, knee, and calf, and sometimes in the arms, To check for deep vein thrombosis, a transducer is moved over the skin, directing the sound waves to the veins being tested. These waves are then reflected back to the transducer to create a moving image on the computer. The absence of clots reduces the likelihood of deep vein thrombosis. Fourth is CT pulmonary angiography, which creates 3D images that can detect pulmonary embolism. In some cases, contrast material is given intravenously during the CT scan to outline the pulmonary arteries. Fifth is ventilation perfusion scan or VQ ratio scan. When there is a need to avoid radiation exposure or contrast from a CT scan due to a medical condition, a VQ scan may be performed. In this test, a tracer is injected into a vein in the arm. The tracer maps blood flow or perfusion and compares it with the airflow to the lungs or ventilation and can be used to determine whether blood clots are causing symptoms of pulmonary hypertension. 6 is pulmonary angiogram. This test provides a clear picture of the blood flow in the arteries of the lungs. It's the most accurate way to diagnose pulmonary embolism, but because it requires a high degree of skill to administer and has potentially serious risk, it's usually performed when other tests fail to provide a definitive diagnosis. In a pulmonary angiogram, a catheter is inserted into a large vein and threaded through the heart and into the pulmonary arteries. A special dye is then injected into the catheter, and X-rays are taken as the dye travels along the arteries in the lungs. In some people, the procedure may cause a temporary change in heart rhythm. In addition, the dye may cause increased risk of kidney damage in people with reduced kidney function. And lastly, MRI is used to visualize the heart and lungs and usually reserved for pregnant women in order to avoid radiation to the fetus. And people whose kidneys may be harmed by dyes used in other tests. Treatment of pulmonary embolism is aimed at keeping the blood clot from getting bigger and preventing new clots from forming. Prompt treatment is essential to prevent serious complications or death. Medications include different types of blood thinners and clot dissolvers. They include 1. Anticoagulants, which prevent existing clots from enlarging and new clots from forming. Heparin is a frequently used anticoagulant administered intravenously or subcutaneously. It acts quickly and is often given for several days with an oral anticoagulant such as warfarin until it becomes effective, which can take days. Newer oral anticoagulants work much more quickly and have fewer interactions, but all anticoagulants have side effects, and bleeding is the most common. Second is thrombolytics. While clots usually dissolve on their own, sometimes thrombolytics given through the vein can dissolve clots quickly. However, they can cause sudden and severe bleeding and are reserved for life-threatening situations. Let's discuss surgical treatment and other procedures. First is clot removal. The clot is very large, life-threatening in the lungs. The doctor may suggest removing it via a thin, flexible tube called a catheter, threaded through the blood vessels. Second is a vein filter. A catheter can also be used to position a filter in the body's main vein, usually the inferior vena cava that leads from the legs to the right side of the heart. This filter can help keep clots from going to the lungs. This procedure is typically reserved for people who can't take anticoagulant drugs or when they have had recurring clots despite use of anticoagulants. Some filters can be removed when they are no longer needed. This ends our discussion on pulmonary embolism. See you next time when we discuss pneumonias.